Hi, I'm Dr. Muthu Murugesan. I'm an ENT surgeon from Manipal Hospital, Klang. Today I'm just going to give you a brief description on sinusitis. Sinusitis is a very common condition that I see in my ENT practice. A lot of patients come and tell me they have nose block, running nose and sneezing in the morning and they think it's sinusitis. But the symptoms of sinusitis are far more than just running nose and nose blocks. It can present with a lot of cough, chronic cough, can present with headaches, fever, loss of smell, loss of taste, as well as a feeling of phlegm dropping down your throat. Sinuses are actually air spaces within our skull. They are around our eyes, below our eyes, between our eyes and behind our eyes. And sinusitis is an accumulation of mucus or phlegm within these cavities. These cavities are originally filled with air. They are there to make our head lighter. They are there to make us smell better. But when you have sinusitis, there's so much mucus that is accumulated within the sinuses that you generally feel very ill. You have a constant headache. There are various treatments for these sinus infections or sinusitis, as a lot of you may know. And the treatment can range from simple medication to surgery. Let's start with medication first. The idea of any treatment is to make the patient feel better. And how do we do that? We actually open up the sinus. That means we open the tiny hole that leads into this air cavity or air space within our skull. The air space or the tiny opening can be opened with medication. For example, there's sprays that we can use, antihistamines, antibiotics if your patient has very bad infection. All of this will help to open the hole. Previously, they used to have surgery if this fails. The first type of surgery was going through the face. They used to make a hole in your face, cut a hole inside and go into your sinus cavity to clear it. Then people came up with endoscopic work where they do not cut. We put a scope inside the nose and through the scope we open up these holes into your sinus. But they found that these two was dangerous. They found that opening holes near your eyes, near your brain can result in a lot of complication. Currently, what we offer here in our hospital is endoscopic balloon sinoplasty. What it means is there's no cutting involved at all in sinus treatment. We put a balloon inside your nose, open up or dilate the balloon to widen the hole, and once it's widened, we deflate the balloon and take it out. The advantage of this procedure is it has a very low complication risk because there's no cutting involved. Secondly, the patient can go home the same day. A lot of my patients go back to work the next day and there's very minimal bleeding. And this has actually changed sinus treatment. The thing is that it just opens up a hole without it being cut. Balloon sinoplasty too has evolved. We used to use lights to find the opening, and currently we use image guided surgery where we actually get a CT scan of the patient, put it up in a computer, and then we can isolate the opening to widen the opening so that we can identify the correct place to put the balloon to avoid complications and avoid any form of unnecessary injury to the sinus. In this way, the patient has a lower risk of any complication and the patient can go back, in fact, the next day or even the same day.